when it's time to begin. All right. Good afternoon, everyone. I'm Professor Debra Smith, the Nursing and Health Sciences Librarian at College of DuPage, and the moderator for today's discussion. On behalf of the COD Library and College of DuPage, I'd like to welcome our remote and in-person audience members. We're excited to have you participate and share in the panel discussion about COD Field Studies Global Healthcare Initiatives, Dominican Republic Medical Mission. Today's presentation is a stellar example of global reach, local touch at College of DuPage. It's the theme tied to the library's larger exhibition of a National Library of Medicine traveling exhibit, Making a World of Difference, Stories About Global Health. It's available for viewing until October 4th on the library's upper floor. Thanks in advance to our panelists for their willingness to share their stories with us. I'd like to encourage our Zoom audience to submit their questions online, where they will be addressed during the Q&A portion of the discussion. Our in-person audience will also be able to ask questions of our panelists during the Q&A. Helping me out today is Assistant Professor Cadet Alex, Liaison Librarian to Technical Education and Applied Arts. They are here with a laptop and microphone, monitoring the Zoom room's Q&A, prepared to read off any questions received during the final portion of today's program. Remote audience, a quick reminder to keep your cameras and audio off so that everyone can hear our panelists' comments. Joining us via Zoom today is course participant Christine Irashata, a PTA, physical therapist assistant, in the acute setting at Edward Hospital in Naperville. Christine may need to pop in and out as she's assisting patients. She participated in the 2024 trip to the Dominican Republic. And turning to our seated panel, we have the two course instructors, Assistant Professor Julie Garcia with COD's nursing program, and Assistant Professor Mitzi Thomas with the Eye Care Assistant and Ophthalmic Technician programs. Rounding out our panel are our three course participants, in addition to Christine. Dr. Sarah Bourne, Professor of Nursing, Carla Cazaro, and Juliana Wolf. Juliana and Carla are COD second year nursing students. So with the introductions made, let's dive into some questions for our panelists. Let's start with our course creators and instructors. What motivated you to create the course, and how did you connect with the Global Health Outreach Organization?
I could start. So what motivated us to create the course were two things. For me, on a personal level, I always wanted to go on a medical mission trip since undergrad, and life happened, getting busy with work and personal life. As far as connecting with our global partner, Global Health Outreach, they share the same mission as far as giving back to the world and society. And so it lined up with what we wanted to do as far as paying it forward and, helping people on a global level.
Thanks, Julie. Mitzi?
So Julie and my stories are very similar in how we got motivated to want to do such a project. We both, have some personal faith-based involvement in community service. We love helping people, and professional level too. Being in healthcare, that's one of the things that we have to do is patient care and helping. So when we ended up actually at a study abroad session, the idea came up about starting a missions trip type of a course where we can bring our students. And then it was, like Julie said, just trying to figure out how can we incorporate what we have here at COD, and how do we partner up with an organization. And so when GHO opportunity ahead came, we kind of started collaborating with them.
Wonderful, thank you. And as a follow-up, I understand that this field studies course is different from most, if not all, COD field studies courses. Can you briefly explain how or why it differs?
It's different because this one is medical mission minded and, being able to work with two disciplines, nursing and an ophthalmic tech and eye care program. So that's different, just that collaborative effort. In the future, we would like to see other health science programs join with us.
That would be incredible. So now let's pivot to our course participants. Briefly, tell me what motivated each one of you to be part of this medical mission. Let's start with Juliana.
Okay. So what motivated me to be a part of this medical mission trip was to serve the people of the Dominican and to also grow my experience and my skills as a future nurse. I wanted to be able to step out of my comfort zone and experience healthcare in a new setting. Being in Santo Domingo showed me the realities of global health disparities and how many families wait and hope for care that we often take for granted here in the US. It was humbling and it ultimately reminded me on why I chose nursing in the first place, to care for people, to advocate for them, and to make a difference wherever I can. That's what inspired me to say yes to this opportunity.
That's really moving. Thank you. Let's hear from Christine. Uh-oh.
No.
Just because I asked, we perhaps lost Christine. So we're going to work on bringing her back. And in the meantime, let's talk with Carla.
Yeah, so I actually had Professor Garcia for MedSurg 1 last year, and I had her clinicals. And every week she would talk about this trip that was happening over the summer. She was always talking about the babies, first of all, how they were so adorable, and how this was an amazing opportunity to practice our skills. And I love to travel, so immediately I was interested. And ultimately, I did decide to go on this trip, mostly because of the adorable babies that Professor Garcia kept talking about. And yeah, it was just a wonderful opportunity to practice what we love doing most, and that's taking care of others. So yeah.
Sure. How about you, Sarah?
Like what a few other people have said, medical mission was something that I had always thought about and wanted to do being a nurse. But I didn't know how to go about it or who I would go with. And, you worry about sometimes the day-to-day things about safety, taking you outside your comfort zone. And so when Julie and Mitzi presented this opportunity to us here at the college, I thought, what perfect way to kind of ease my way into something like this.
Yeah. Okay. Pivoting back to our course faculty. How did you lay the framework of the course before actually embarking on the mission trip?
So with the support of Study Abroad and as well as our division dean and the president at the time, we had the support to actually go to our first missions trip, which was in El Salvador as a participant. So we went there to experience what it would feel like first. And then just really understanding what global health outreach as an organization is like, just to figure out what all the logistics were. And then after that, we also decided when we would bring our students, we would interview every person that was interested in coming on the study abroad trip with us. So we interviewed each one and just basically went through and explained the organization that we were working with, what all of the rules were, and made sure that everyone that was coming on the trip felt comfortable with what they were going to be experiencing. So like Sarah had mentioned, there is a lot of strenuous activity that is involved with a trip like this. And so we just wanted to make sure that all the participants were aware of that and felt comfortable as they came.
Good, thank you. Julie, do you have anything to add?
Yeah, I just wanted to add with global health outreach, why we went with them was one of my best friends has been going on medical mission trips since 2015, and she's actually a pediatrician. Dr. Hannah Chow Johnson, and she's been trying to recruit me for the longest time. And part of the reason is also because of how well organized they are, and that safety is a very much a priority for all of their participants who come along on these medical mission trips. And so that is one of the reasons why we partnered with Global Health Outreach, was because we knew that we would be well taken care of along with our students and of the course participants. So it's they're very well organized. They think of everything. They have all these contingency plans in case of natural disasters or political riots or whatever upheavals. So it was really well done, and we can't think of anywhere else to go with partnering with besides Global Health Outreach.
Sounds like that organization is powered by librarians. We're very organized and have contingencies for our contingency plans. But now let's ask our participants, based on what you researched and discussed prior to going on this mission, I'd like to hear from you an example of what you expected and then what you actually experienced during your mission trip. Carla, why don't you start?
Yeah, so going into this trip, I did expect a degree of lesser healthcare in a sense. A few examples of that include most of the patients that have parasites. Most of the patients did not have access to clean water. However, one thing I did not expect was the patient's demeanor. I feel that here in the States, most people are, in a sense, irritated or annoyed to go to the doctor. It's something they don't look forward to. But in the DR, it was an overwhelming sense of joy almost when the patients came to us. Although they may have been traveling for who knows how long to get to us, waiting for however long as well, they were always so happy and just have overall positive mindset to be able to be treated. So I thought that was beautiful.
Thank you. Sarah, you're up.
So I've had this opportunity. I went on the trip in 2024 and the trip from this past summer, 2025. And so the first time I tried not to expect anything. I had, what I thought I would, I knew I was going to go provide healthcare, go work in a pop-up clinic. Wasn't sure what that was going to look like. Assumed I was going to be functioning as a nurse because I am a nurse, and I actually didn't do that. And that was one of the things that was actually by choice. I chose to step outside of my role of a nurse. And the first year I worked in the pharmacy. Second year I worked in with the dentist. But so I tried not to expect anything when I went there, but I did know that the healthcare and the individuals I'd be serving were definitely going to be different than what I'd served here in the US. Coming out of it, kind of like what Carla said, it's just very moving, and how appreciative and what little they may have, but what also we were able to use as resources to also get the job done for those people.
Great. Thank you. Juliana, do you have anything to add?
Yeah, kind of just to bounce off of what they both said. We all expected to see that the community had fewer resources than we do here in the US, but for me, I don't think I fully understood the reality of exactly what that looked like. We all know Giuliani, the little girl that got hit by all of us. We talked about it a lot, but she was one of the little girls that came into the clinic on the first day, and a couple of days prior, she had gotten hit by a motorcycle. And obviously coming into clinic, you could see this little girl is hurt. And when asking mom if she had sought medical care after this incident, I was told no. And at that moment, it really struck me, because back here in the US, a child in that same situation would have almost immediately been taken to the hospital. Every scan, every test would have been done to make sure nothing more serious was going on. So while I expected to see limited access to healthcare, actually experiencing it through this little girl's story made it much more real to me. It left me feeling sad and helpless, but also more determined to continue serving and advocating communities like this.
Now, is that the little girl that we see on this introductory slide sitting on
Right
your
there.
lap?
Mhm.
Oh, you know, it's heartbreaking, but it's also beautiful how you provided care and how you were able to do something that if you hadn't been there wouldn't have happened at all, right? I'm glad it was a positive ending to that story. So I think all of you bring up some really good points that I'd like to dive into a little in with a little more detail. This is for everyone on the panel. What are some of the most striking similarities and differences between healthcare in the US that many of us take for granted and healthcare in a developing country like the Dominican Republic?
I would say overall, just the basic lack of access and lack of resources. That's like the overall difference, I would say.
And the lack of education, um, health education, basic health education, being sanitary.
Hand washing.
Yeah.
So basically all of the things that, you know, we hear in our schools and in our annual exams and child wellness visits and things like that, that's just completely absent, right? Is
Yeah.
that's what you're saying?
Mhm.
Wow. Do any of the rest of you have any other similarities or differences that you feel the audience might benefit from hearing?
So one thing that I noticed in the eye clinic specifically was, we have many conditions that patients have to come back for follow-up care and routine care for. And so when we would tell them to do that, there's no guarantee that they're going to get that because they can't afford it most of the time. So that was really heartbreaking to think that we're sending these patients out and telling them, make sure you go and see someone to get your eye pressure checked, but there's probably a chance that they won't be able to do that.
Anything else?
Also, too, going back to what Ms. C said, the one day I was in the eye clinic, she taught me about the risk of not wearing sunglasses. And wearing sunglasses there is like
It's for the tritium.
what?
Tritium.
Yeah, but what wearing sunglasses there
Seen
is
as
like,
a fashion statement.
Yes.
rather
Oh,
than-
yes.
yes, rather than for health.
Yeah.
And so they're not advised to wear sunglasses to protect their eyes. So a lot of times, can you say the word? I can't say it.
Yeah, so there's a condition called pterygium. So it's like a flesh that can grow on your eye from overexposure to sunlight.
And a lot of patients came in with the start of that happening. So yeah, it was interesting to see that as well.
The more we talk and share stories, the more I'm touched by the idea that even the littlest things we take for granted are huge and can really impact in positive and negative ways health on so many levels. So I understand that this past trip, some of you got the chance to view and learn about the water filtration system and overall quality of water that was available to the community where you were located during the mission. Can you explain why the filtration system is necessary and how water quality differs from what most of us in the audience are accustomed to?
So in the Dominican Republic, especially in the area that we served, they do not have the means nor the access to clean water. Their water is, when we went to the homes to deliver water filters, you could see actually the water that they had, you could see things floating in it. You could see that it was dirty. Also, things that you can't see that are also typically there are parasites. And they do not have the water systems that we do here in the US to provide clean water on a regular basis. So they're oftentimes having to go to the river or they're getting water from, they all had like these reservoirs on the roofs of their homes, some of the homes, not all of them, and that would collect the rainwater. And so those were just two examples of how they would get their water. And then the community, a lot of times you would be sharing that collection of water amongst each other. They had what was called a tap in their homes. And so they literally just go, the way I saw it and envisioned it when I was there was it's like a pipe that would come down from the roof or from wherever their source was. They'd go to that tap, and whatever water came out of the pipe is what they would collect in a bucket. Now, for it to be able to be clean, they would have to boil it. So, and they don't have the means to be able to have a regular filtration system. As we know, it costs money. Also, many of the other individuals within the Dominican, outside of like the individuals that we worked with from the church, you know, they always would drink bottled water. So if you think about how much bottled water costs, you know, how much we might pay from day to day buying a bottle of water, think about that's what they're doing on a regular basis. And we were also it was very apparent to us because we were told, don't drink the water. Also, their plumbing systems are very different than ours. So the septic system. So the way you would handle your bodily fluids when you went to the bathroom was different. And that's just, so that's examples of, they're not at the same place we are with the technology or the resources that we are here in the United States.
Julie, do you have anything to add?
What was exciting was being a part of teams that went out in the community to various homes. And the water filters that we were able to bring were literally 5-gallon buckets that had a spigot at the bottom that had a filter inside the spigot. So if it's maintained well and, you know, cleaned, it could actually last 12 to 15 years. What was interesting was, even though we delivered these 5-gallon buckets to various homes, they were told you need to be able to share this with your neighbors and, you know, the neighborhood and in the community. And they're like, okay, we will. And that wouldn't be something that we would see here. If we were to share our water filter buckets with our neighbors, I don't think that would happen. So
Yeah, step
was
away
really-
from my bucket.
yes. But it was just amazing to be able to deliver that. And just, you know, so we actually had to teach them how to, you know, how to set up the water filter using these buckets and how to clean it. And that we were able to tell them, you now have clean, safe water that you can drink, and you can even have ice water. And the smiles on their faces, they're just lit up. And then with the demonstration, we had them do a return demonstration, but then they were able to drink the filtered water that they filtered using the 5-gallon buckets. And it was just amazing to be able to be a part of that team, but to see that happen as well.
That's great. Thank you. So now we've learned a little bit about the situation of the people in the community outside the clinic. Let's talk about those 8 days that you spent actively participating in the medical mission. I'd like to start with our course participants. Can you give me your most vivid impression of this experience? And eeny, meeny, miny, mo. Let's start with Juliana.
There's so much that happened in these 8 days that they're all vivid. You can add in because this is your experience, but I was sitting right next to her, so we all experienced it. Diabetes is really bad there, uncontrolled diabetes. So patients they don't have access to resources, healthcare, going and seeing their primary care providers. So they don't usually have the means or accessibility to check their blood sugars. So a patient came in and she sat down and got triaged by Carla. Yeah.
So this lady's primary complaint was her vision, and she claimed that her vision was so bad that she was afraid to leave her house, which was obviously impeding her from getting any health care. And then through triage, I eventually asked her if she has a history of diabetes. She then started crying, couldn't just tears rolling down her face. Immediately, we all started hugging her. Juliana gave her a little bracelet that she made. So we just tried to comfort her the best that we could. When she calmed down, I checked her blood sugar. It was in the range of 650, 660. And for those non-healthcare, a regular blood sugar should be between 70 to 110. So 650 is very, very high. So we had to ultimately send her to the hospital. But before we did that, we did pray for her. We had like a little huddle. We prayed over her. And you could see like her face almost light up after we had comforted her. And I feel that in a sense, what we did for her emotionally and mentally was more powerful than what we may have done for her medically. And I think that speaks a lot for this medical trip.
Also, too, a lot of things that we did see were older fathers and mothers living on their own, and not having any family
Yeah.
or friends there or transportation.
Which is, I should have mentioned this, but that's part of the reason this lady was so upset, because she was older, she was very frail, and she had no one to take care of her. She had no kids, no parents, nephews, uncles. So she was just by herself trying to manage.
Yeah, and that was relative. Like,
Yeah, to
we
most of the
saw that a
patients.
lot. So yeah, it was really sad.
Sarah?
My experiences were a little bit different because they were working in triage. So they were the first ones to see everybody that would come in. And I worked upstairs in the two of the clinical settings. So like I said, the first year I worked in the pharmacy. The second year I worked with the dentist. And in the pharmacy, it's just, I felt that first year I was there, I was like, I feel like we're just putting a Band-Aid on things. We would come and they don't have the means or the access to something as simple as a multivitamin. And I say simple because that's simple to us. But we would give them 30 days of vitamins. And that's why I say it's a Band-Aid, because we give them a month's supply, but then what would happen when the vitamins ran out, or we were giving prenatal vitamins to women that were pregnant or wanting to become pregnant. And so just thinking about that, and then other things that we would have to treat, or I would see prescriptions for yeast infections, different skin issues that, just were predominant in that area or that setting because of how they lived or the resources that they had for cleanliness. So that would put them more prone to different infections. In the dentist office, the way in which we had to do dental procedures. Here we are so blessed to have equipment and medication, and here the people were so excited and thankful to see the dentist, but it was your very straightforward extractions. That's all we did in the dentist office was extractions, and it was numb the gums and literally pull out the tooth. And somebody could be sitting in our chair, and actually our dental chair the first year was literally a lounge chair. This past year, our dentist actually ordered and brought a little bit better of a chair, but it still wasn't the chair that you would sit in when you go to the dentist. It wasn't comfortable. It doesn't go up and down with the little pedal. And they would sit there. It didn't matter how long it took to get a tooth out. it would take like 20 minutes, sometimes an hour to get a tooth out of someone's mouth. And they would power through it and they would be so thankful. We had one gentleman, he dropped to his knees after he got out of that dental chair because he was so thankful. And then he went around the room hugging all of us in the room. And it's so simple. Like, I look at that, I'm like, all I did was help pull a tooth, but to him that meant the world, and they wait months for us to show up. They don't have access to that on a regular basis. So when we show up, they're so thankful and they're so ready. And, it's different than we are here.
Yeah, thank you. Mitzi, Julie, I want to rope you two into this as well. And I invite you to also speak on behalf of course participants that aren't with us today. Today, our panelists all are involved in the healthcare profession, but you should be aware that anyone can participate in this medical mission field studies course. And there are participants that are community members that don't have a healthcare background, but still want to help and want to go. So, if you could talk just briefly about, the kinds of roles that people perform, maybe focusing on the ones that don't have a healthcare background, because we've already heard what our students can do and what you as practicing professionals can do.
I can start. So specifically in the eye clinic, I had a lot of help on both trips actually with non-eye professionals. We get pretty busy in the eye clinic, and we actually did not have an eye doctor, so it was quite busy, and participants that had no eye knowledge previously were able to help me immensely. So things that we can just train them on while we're there, like a 5-minute training and say, can you help with reading the eye chart, helping us read the eye chart? Can you help with reading glasses? I'll tell you what the prescription is. Can you just go pick out those glasses and give them to the patient? We also had translators with us, Spanish translators. So they came from, they were from the DR. They're part of the of Global Health Outreach and the church that is there. And so these are high school students that basically are with us along the whole way, translating and kind of our voice the entire time, whatever we need to communicate with these patients. And they were remarkable themselves. At some point, they were doing, some of the things the healthcare things that we had to do in the eye clinic without me having to prompt them because it was so automatic for them from how many patients we had seen. So that was just remarkable to see how in their community, these young high school students are just helping us. But yeah, in general, just everyone's help in the eye clinic was very beneficial. And a lot of my personal help was non-eye professionals, and they wowed me.
That's great. Julie, what can you add?
First of all, I just want to say Mitzi can train anybody because she had all these high school students in the 3 years that we've gone on, medical mission trips. And so it's really exciting to have high schoolers join us. So there is a place for everyone. So there's roles, responsibilities. There's just the hundreds of people that come every day. It's just all hands on deck. So we could use anyone's help. There is a kids area that we had non-medical people help, like specifically the high schoolers that, were able to engage the kids of patients. So as patients are being seen by providers to entertain the kids, there was a kids area that had like coloring books and crayons and markers and stickers and reading books and things like that. So it was a ton of fun. I just want to also recognize the Student Nurses Association and my local church for donating boxes and boxes of toys and things for the kids to play with. So that was very beneficial, was being able to plug plug in the high schoolers to help out with that. And, they would pass out balloons as well. Last year, there was a girl who helped by making balloon animals, and that was a ton of fun. It went really well. She would also make swords, and it was a huge hit. The other thing is, we actually had every year we've had like someone who is a non-medical personnel who they have helped with getting heights and weights for in triage, nursing triage. What we would do would get vitals. So we get a full set of vitals, get height and weight. And so the non-medical people are able to help get the height and weights of our patients, including the babies. So like the moms would hold the babies or the parent would hold the babies, and we'd get the weight of, we would subtract it. So we'd get their weight first and then get their weight with holding the baby. And then we would subtract it to be able to figure out what the baby's weight was. So it was really cool to be able to see how everyone was, very willing and motivated and enthusiastic with wanting to help. And mind you, there wasn't any air conditioning at all. And they have these large commercial fans, and so or floor fans. And so it was pretty hot, and we had to make sure that the providers were well hydrated. The organization GHO would make sure that we were well taken care of, along with our local partner church, Oasis Church. They made sure that we're well fed and well hydrated, as providers. So it was really great to see not only all of our people on our team, but also the local people from DR. I did also want to say some of the providers brought their children, and so those were the ones who helped as far as non-medical. So it wasn't just our team. Like this year, we had a team of 13 from Chicago, and then there was a total of 24 people. And then last year, I believe it was like 35 people. So it's nice to have that kind of professional networking, meeting other providers and people and high schoolers from people from around the world and around, we had people from various states, so it's hard to name them all off, but it's really cool that we're still friends with them. We can still connect with them, and being able to, build that kind of camaraderie and relationship with people from around the world.
The levels and types of collaboration between organizations and people and local individuals, and those of you coming in for a specific amount of time and then leaving, it's very breathtaking, and it's admirable to see that humans can reach out to other humans in such a positive, supportive way, when so often we're bombarded with situations that are not that positive. And I just want to acknowledge how uplifting it is to be able to hear these examples today. So you've all done a really good job, I think, in the questions that you've already answered to help us as an audience understand, the differences between providing healthcare to citizens in a developing country as opposed to what it's like in the United States. So I think I would like to jump ahead to our last question, which is honestly my favorite question out of everything we're discussing today, believe it or not. And that's, what's next? Faculty, instructors, I'd like to know, are you planning to continue this course as it is? Would you like to create something similar or different? For those of you that were participants, what's next for you? Have you created or have you thought of next steps that have evolved based on this mission trip? And I'll let you fight for who starts.
If I could, for me, I'm not quite sure where we're going with the Global Health Studies course. I'm under the impression that we're taking a break, but there's a lot of planning and work. Mitzi and Julie have done a fabulous job, and our field studies department. But for me personally, I'm thinking about, how can I continue to do similar work? Um, whether that's with the same organization or maybe different organizations, and seeing if there are other experiences out there that I could partner with. I think too, I need to take next summer off, um, 2 back-to-back summers. It's so great, and that's the thing is because it's so great, as soon as you come back, you're like, "I need to do that again. I wanna go right back." And you miss the people. We miss you because you have such a great team. But you also have to think about life and reality of what's here and what we have to care for, and, but that's where I am. I think this is so inspiring for our students. The things that I'm hearing them say today, I'm holding back tears right now. Um, it's just so cool. They're not even nurses yet. And the difference that they made and the difference that they've seen, it's just so cool. And so this opportunity for people to just keep doing it. I don't know.
How about you two? I see you smiling. We just talked about all the fabulous things you shared with us. Next steps?
Okay, so while there, um, another thing, I mean, there's so many things I could talk about, like the reality of health disparities there. But in particular, something that bothered me a lot was babies, disposable diapers were getting reused. So instead of throwing out a diaper after it's dirty, it would go back home, probably get washed with water with parasites in it now. They don't have the means of having clean water, and then put back on the child. And so I'm seeing this and I'm seeing the diapers fall apart and the stuffing coming out and exposed, and knowing that this can lead to infections and all of that. I wanted to do something from home, because I can't go back right now. I have school. I would though if I could. But to be able to make a difference still from home now that I'm at home. So I created a GoFundMe, and I'm in SNA, the Student Nursing Association, and partnering with them, partnering with Oasis Church, that partners with GHO. We're going to raise the money to then send to them, and then they are going to send us photos of the diapers getting delivered to the families in need, the moms in need, the babies that are in need of diapers. And yeah, that's my next step right now.
Oh my gosh, what an awesome project. Can I ask, is it okay if I get information from you and I post links to that GoFundMe page and that initiative on our Making a World of Difference Stories About Global Health website
Yeah.
so that we can share that with others? Yeah, you think that'd be a good idea? That's
She
That-
brought you a flyer.
Yeah, I
She
made a
brought you
flyer.
all a flyer.
flyers available after the presentation.
And then when I become rich enough, I'm gonna get them a water plant. So
And it's
they can
good to
have
have
clean water.
clean water. You don't see anything wrong with that. That's great. How about you?
Well, first of all, congrats to Juliana for arranging for this GoFundMe. I know it must have been a lot of work to partner with not only organizations here, but organizations in the DR as well, which is a huge load to take on. I am looking forward to hopefully planning another trip like this. I definitely want to go another one. The tricky part is deciding between maybe going to the same place or sort of expanding and figuring out where to go from here. Because it would be nice to see the same patients, see how they've maybe improved, what stayed the same, what's different, just to see the people again. But also be cool to go to another country, experience another culture, and just grow in that way. So that's the tricky part about it.
It is, but I think all of us can tell how this experience has really fundamentally changed how you view healthcare and your awareness of patients and their particular needs given their location, right? So thank you for sharing that. Mitzi, Julie, next steps. 3 years in a row. I should tell our audience the first year that this field studies class ran, our participants went to Ecuador, and then the last 2 years they've been in the Dominican Republic. So,
So first of all, we're so grateful to everyone at the college that has helped us to get to this point in being able to have a course like this. It is more than we could have ever imagined to be able to do. Just hearing the students speak today, and when the students, give their final presentations after our course, it really moves us because it's more than we ever imagined that we can do. So we've been blessed to be able to go to the Caribbean. We've been blessed to go to South America. And we do want to get out further into the world. But there's obviously a lot of schedule challenges when it comes to planning events like that. So that's in the works. We do want to get out further into the world with our students. And so we're just looking at opportunities on how we'll do that. As far as when is our next trip, we're figuring that out. To be determined is all we're going to say right now. But one thing that, wanted to mention is while we were planning this, one of the biggest concerns I think we would have is there are so many students that want to participate in this, but the financial aspect is an issue. And so I know that Julie and myself, we are looking for opportunities to bring more scholarship opportunities to our students so that more people can come with us in the future. So yeah, so that's basically it.
Julie, do you have anything to add?
Yeah, I think it's sad because I look, over the past 3 courses, we've had a number of people who are interested, a lot of students who are interested. And we had a wonderful team every year, and to Ecuador and to Dominican Republic. But we did have a number of people who withdrew because of financial concerns. And it was really disheartening for them because they went through the whole interview process, applying, and then also getting a letter of recommendation only to have to withdraw. So, immediately right before we had to, purchase our airline tickets and, submit everything and stuff like that. So, I actually reached out to the consulate of the DR, and also reached out to the consulate of Ecuador to see if anyone could help us. Unfortunately, only one of them replied back. I don't know if I had the right email address or something, but I'm like, can you help us? We're going to your country. But we do want to continue to keep our momentum going. We do need a break just because of what's happening in our personal lives. It is a lot of work. It's at least a minimum of a year of planning. We're hoping to have more advance notice to help students so that they're able to raise funds, sooner instead of later, so that they won't feel the need to withdraw, so that we'll have a robust group of course applicants and participants. The other thing is that is somewhat challenging is and something that we would like to have happen is we need other people from other disciplines, not just ophthalmic, tech, eye care, and not nursing. Like, Christine was part of our alumni from physical therapy assistant program. And so we would love to have, there's so many different programs here in health science, and we could find a place to have them help us. And so we would love to have more faculty. We are very fortunate to have 2 nursing faculty join us this year, but we would love to have faculty from other disciplines. And education is a huge need, whether it's, teaching patients about hand sanitation and safe, safe food, storage and preparation, but also like, respiratory issues or even surgical. Like, ideally we would like to have a course where we partner with someone where we're able to do surgeries. So we have a surgical tech program. So we would love to get the word out and just recruit more faculty, but also from different programs as well. And not just our programs, but also, community partners and also professionals. So they don't have to be students. So we're just looking for, moving forward, looking for all types of, professionals as well.
And I think we can add in, because we've heard that community members, there's always something for someone if you have the need and the desire to assist. So I think a good way to wrap that up is to encourage people, if they feel called to participate in something like this, to get involved and to help find solutions so that the people that want to go are able to go. So I'm sure that our audience may have questions for our panelists. So Cadet, if I may ask, were there any questions submitted online?
No questions yet.
All right, now's your time, audience that is remote. If you have questions, please submit them so that Cadet can share them with us. And let's turn to our in-person audience. Go ahead.
Well, first, I want to say I've never been so proud to be a COD faculty member, to be able to hang with colleagues, other faculty members, and I'm so proud of you students. I mean, the future looks so bright for our graduates. So my question to everybody is, have you made a connection, whether it be a colleague or a friendship that you plan to continue?
We build the people we probably build the greatest relationships with is the rest of our team, but also our interpreters. And so we have a group chat on the WhatsApp, and we're all connected, and we're always sharing stories with each other. We told them about today and that we were going to be talking about this. And, that's a group of individuals from around the US, but we also stay in touch. Some of us stay in touch with our interpreters. And so I'd say yes. And then you follow each other on social media. And so friendships from afar.
Dr. Jack.
Oh, yeah.
Yeah, like Bourne said, I feel one of the most unexpected relationships that I didn't expect to form were those with the interpreters. So again, they are a bit younger than us, not too much, but a little younger. So I didn't really expect to be able to relate to them as much, but they were just so enthusiastic. They were so willing to help out. They're really just an amazing group of people. I know me and Juliana, we follow them on social media, so they can see what we're up to. We can see what they're up to. So it's just nice to sort of get to know them as a person outside of the mission trip. And then I know for me and Juliana ourselves, we weren't really that close before this trip. But after being with her 24/7 for 8 days straight, I can tell you there were definitely times we got irritated with each other, but we definitely grew a closer bond, and I'm thankful for that experience.
Yes.
Are there any other questions?
It's a question mostly for students, but feel free to answer. I'm curious how your experiences might influence courses you might take in the future. And the second part is, how do you imagine it might impact how you interact with patients here in the future in a clinical setting?
You want to go first?
Yeah. I think that now after going on this trip, courses I want to take is just expand my knowledge more globally. So maybe learning more languages. I realized that when I was there, I wanted to communicate with some of the patients sometimes. So I want to learn Spanish fully. And then eventually when I go on other mission trips, be able to learn those languages as well, because it would be nice to be able to communicate with patients in their own language.
Yeah, like Juliana said, you learn Spanish in school, but
Yeah.
in the real world, it's not like what you learn in school at all. And then for your second part of your question, in terms of caring for patients, like I said with my story or how I explained, it kind of taught me, maybe all of us in a sense, that when you care for a person, it's not just in terms of like their medical symptoms or physical, you need to take care of them as a whole person. And that really stood out to me on this trip. So again, with the lady, taking care of her emotionally, taking care of her mentally. And in this case, I feel that helped her more than her actual physical symptoms. So yeah, just taking into consideration the person as a whole.
That is a theme that we've heard, is the importance of holistic care,
Yeah.
right? Caring for all aspects of people. And it's not just caring for patients. I think you've also demonstrated that holistic care that you've given to each other. And that was part of this trip and all of the people that were involved. I personally find that incredibly inspiring. So I hate to say it, but our time together is drawing to a close. And I want to say thanks again to our panelists and to everyone that joined us today. What an amazing story we've collectively written and recorded. Speaking of recording, I will post a link to this session on the NLM resource guide. It is located at library.cod.edu/NLM. And there will also be a link to a GoFundMe page for the diaper drop. Right? As we close out and as we give our panelists a round of applause, Cadet, when it's drawing to a close, you can please end the recording. Thank you, everyone.